Thank you so much. Good morning, everyone. Thanks for having me today. As you can see, I am joining you from an UNRWA warehouse in Amman, Jordan, which really speaks for itself. Everything around me is aid that is supposed to be in the Gaza Strip right now. It is really a stark reality from the warehouses that we have in Gaza. Even just this morning, I was looking at footage from colleagues. Everything's empty. The warehouses, the distribution centers, they've been empty for weeks. So around and behind me, it's just full of supplies. There's more food here for 200,000 people for an entire month. There's medicines to keep all of UNRWA's 9 health centers functioning and 38 medical points functioning. That's enough medical care for 1.6 million people. There's hygiene kits, enough here for 200,000 families, blankets for 200,000 families, and learning supplies for 375,000 children. This is just the supplies that are around me here. We have supplies in other areas as well, like Egypt. The situation is absurd. It's appalling, and to be quite frank, it's unforgivable. All of these supplies that are around me are literally 3 hours away from the Gaza Strip. They could be there this afternoon. Meanwhile, we continue to see these horrific images of malnourished children. We continue to hear the absolute worst living conditions our colleagues could even imagine facing. Every single basic supply, the basic necessity that a human should have, they are deprived of right now as we speak. The international community and the United Nations have been very clear. These supplies need to be in Gaza now. There is absolutely no time to waste. It has been 11 weeks of siege on the Gaza Strip. It's a deficit. Anything we provide now is trying to undo damage that's already done. For many, it is too late. But let's have this right. The supplies that I'm talking about and the ongoing starvation, this is only one part of the horror that we're seeing every day. There are indiscriminate strikes. Yesterday, we had 2 UNRWA teachers who were killed, and UNRWA school turned shelter in Nusayrat. Initial reports say 7 people were killed, including children. This is one of many attacks on UNRWA facilities that we've had in recent days and weeks. My colleague, my friend Hussein, he's been telling me the last day how he's just buried the remainder of his family. This is aunts, uncles, children's. In a strike in Jabalia, and he has spent the last few days trying to dig these child relatives out of the rubble. 2, he tells me, a 10-year-old and a 7-year-old, they still cannot reach. It is appalling. My friend and colleague Raja, she witnessed a very young boy killed in a strike before her eyes. And when I spoke to her, she just said, I cannot take this anymore. She had nothing else to say. She cannot take this anymore. I don't think anybody in the Gaza Strip can take this anymore. Yesterday in Khan Yunis, another large-scale displacement order was issued. This area now covering 23% of the entire Gaza Strip. Where are people going to go? We have been saying this for 19 months. These people are trapped. There is no way out of the Gaza Strip. There are no supplies for them. They're being starved. They're being bombed on a daily basis. How much more does the world need to see before there's action? What else can we possibly say at this point? I really have nothing more. 19 months of talking about these horrors day in and day out. The situation is appalling. It's horrendous. And that's over from me. Thank you.
Thank you very much, Louise, which we would like really to send our condolences to the families of your staff, of your colleagues who have been killed. And unfortunately, as we know, this has brought, this very grim milestone of 300 staff members killed in Gaza, which is, of course, atrocious. And the Secretary General said it at his last press conference in Iraq. Nothing justifies the atrocious October 7 terror attacks by Hamas, but nothing justifies the collective punishment of the Palestinian people, which has to cease. We need a permanent ceasefire, the unconditional release of all hostages, the free flow of humanitarian aid, and irreversible action towards a 2-state solution. And I'll now give the floor. Please stay with us, Ruiz, because there will be surely questions. I'll give the floor now to Dr. Akihiro Seta. Dr. Seta, thank you very much this year to be with us. As our colleagues, journalists know, every year you give us an update related to the annual report on the Department of Health on UNRWA, focusing on the main indicators regarding health of Palestinian refugees. And of course, what we have heard is speaks about by itself, but you have more. Yep. Please.
Thank you very much. It's always good to come back every year to explain. And it's in the media now, in the website. This is the annual report we published. And then that this will be available. And half of this report has a data set of what we are doing, and then half of them a narrative to explain how we are doing under a very difficult situation. And then this is a sign of our pride. Every year I'm very proud to come back to tell to the world that this is what we are doing. And it's amazing because that, say, for example, I go to Gaza later, but since start of the war, we take care of the 8.5 million consultations since the start of the war, and it never stopped. And we have health centers functioning, medical points functioning. And the West Bank, because of also the atrocity in the northern part of the West Bank, our health center still managed to cope with the needs of the patients. And we have 2 health centers in East Jerusalem. It's still functioning. So UNRWA stays deliver. And as the largest primary health care provider in Gaza and the second largest primary health care provider in West Bank, we still continue to deliver the care, taking care of the pregnant mothers, babies, immunizations, and diabetes, hypertension, anything that they need to seek to our health centers as much as we can respond to them. So I'm very proud of this, and then I really appreciate that almost 3,000 health staff, but also 28,000 UNRWA staff. They continue to work under extraordinary difficult conditions. That's amazing. That's truly amazing. At the same time, Gaza is not sustainable. Those who came last year may remember I said that when I went to Gaza, today is worse than yesterday, and tomorrow is worse than today. And unfortunately, this never changed. Rick just left Gaza, so he can tell more. But my last visit in Gaza is the mid of January, before the anti-UNRWA Knesset bill took place. And it's still 3-4 months ago. But I really can't tell I know Gaza. It's totally different from the people. When we speak to the staff who are coming to work every day, they say that when I ask them, how are you? The answer is, I'm not good. Even the greeting level, I'm not good. And what are you thinking? I still remember one of the staff said, I'm thinking only 2 things: how to survive, how to die. This is truly unfortunate, and the shortage of everything, and the famous IPC report came out, and the malnutrition is on the rise. I have data from until the end of April, because May data we don't have yet. It shows the malnutrition is on the rise. It went down when the ceasefire happens. It went down, but now it's on the rise. And then the worry is that if the current food shortage continues, it's exponentially increase, and they're beyond our control. Rick and myself visited Gaza many times before the war. We always enjoyed the nice people, nice food, nice environment in Gaza. It's unthinkable that 10% of kids are malnourished. It's unthinkable that we have severe malnourished children in Gaza, where they used to enjoy the life. And there's no life in Gaza. That's what our staff says so. And this will affect our operations. And then today, Luis mentioned the 9 health centers. Luis, sorry to say that I just heard that we have only 7 now. 2 closed, Man, and then the other Hamad Health Center in Han Yunis closed because they fall into the evacuation zone. And so that every day it's different, and every day it's getting worse. But even at this time that we continue to provide the services, but we have 2 main problems. The one is security, which Luis introduced, but second is that the restriction of our movement and the transportation of the medicines. We use around 100 medicines in our primary health care, and 1/3 of them already stocked out, simply because nothing came in from the 2nd of March. If this continues in Gaza, that we face almost 50%, half of the medicine will be stocked out by the end of this month and further on. And we have the largest primary health care provider in Gaza. Without medicine, what we can do? And then we have that we have a common called medicine, but we have a life-saving medicine like insulin for the type 1 diabetes patient. Insulin is lifelines. Same for the hypertension and others. If we run out of medicine, whatever we do, people will suffer more. And it's totally unnecessary. If you go out of Gaza, in 1 kilometer, 2 kilometers, you can buy everything without any problem. Inside Gaza, you can't find it. And as you can see in the backside of Louis' photo, we have plenty of medicine in Jordan that could solve, and plenty of food in Gaza, in Jordan, that could instantly solve all the suffering for the Gaza people to a large extent. If the borders are open, and then we can bring them in. And we are ready to bring everything in the pallet, everything in the truck. Once it's open, we can send all the medicines. It's totally frustrating. We see the stock out of medicine, but we couldn't bring in. And we are not allowed to bring anything with the name of ours. So because of Israel restriction. So that's what we are going to do, and that's the biggest problem. And I tell the world that please, let us bring all the medicine, the food to solve the suffering of the Gaza people. Thank you.
Thank you very much, Dr. Seita. And as you said, I mean, the annual report is online, so the journalists can access it. If there's a press release related to that, it would be good to send it out. I'm looking at the colleagues, UNRWA colleagues on that. And now let me turn to my right. Rick, it's so nice to have you here. First of all, because you're safe, you're well, and you're with us for the, I guess, for WHO press assembly. And also because we can hear from you in person about this health situation in Gaza, in addition to what Dr. Seita just said. Please.
Thank you very much, Alexandra, and also thank you very much, Sita. And it's really indeed good to be here in person, and I especially tied up for you, so that's all good. So I was on another mission in Gaza last week, and difficulties getting out, but it's and a little bit, I think, referring to the former speakers. So every time you get into Gaza, you actually always think it cannot get worse, but it gets worse. So I want to focus a little bit on the general issues, and then I want to focus specifically on the health systems, and I want to close with something on mental health. So first of all, if you look at the figures since 15th of May, the intense hostilities killed many, but displaced close to 40,000 people once again. And overall, I think we've seen a displacement of more than 500,000 people across the Gaza Strip since mid-March. So this bloodshed, I mean, must, of course, stop. Then if you look at the health system, and specifically, I want to focus a bit on the health system, is being pushed to its limits and facing attacks and acute shortages of supplies. And when I went to the hospitals in the north last week and in the south, and we brought in the dwindling WHO supplies. So everywhere we got the same messages. There's a lack of everything related to trauma and trauma care, IV fluids, antibiotics, but also what Sita mentions, for example, insulin, more complex oncology treatments, but also simple things like disinfectants and cleaning material. I mean, that's what we are talking about. On attacks, so since October 2023, WHO has documented 697 health attacks in the Gaza Strip. And again, WHO urges for the active protection of healthcare. Hospitals must never be militarized nor targeted. Just to give you a quick update, and that is all because it's changing actually as we speak. It's changing as we speak. When you go to the north of Gaza, so you see intense hostilities and military presence in the vicinity of Indonesian hospital since 18th of May. Hospitals barely functioning, hardly any access in or out. Roads have reportedly bulldozed. Most patients self-evacuated after hostilities intensified. On 15 May, a killing of a staff member, injuring one patient, etc. Only 15 people including patient staff, remain in the hospital. They urgently need food and water. The hospital's generators was reportedly hit yesterday, causing a blackout. WHO is now planning a mission to transfer the patients to other facilities for continued care. This hospital is supposed to be protected. Al-Ada is the only hospital currently partially functioning in the north of Gaza. It's acting as a trauma stabilization point, again overwhelmed with injuries, running low on supplies, ongoing hostilities since the 15th May caused panic and deterring patients also for seeking care. And Kamal at 1, I was there as well, slowly rehabilitated after attacks, because after the attacks it left it non-operational, mainly focused on pediatric care, now also taking a general and even trauma patients, etc. We're also providing a nutrition stabilization ward. If you go to the south and then in the south, when you go to Nasser, yesterday there was an attack and damaged a WHO-built warehouse. And according to the hospital director, 30% of the warehouse and the critical WHO supplies were reportedly destroyed. Assessment of the management is ongoing to determine the full scale. We reported this attack on the bird unit last week, which destroyed 18 beds. European Gaza remains out of service. Following an attack on 30th of May, WHO team was just in to do this massive medevac of 300 patients and companions, etc. That hospital closure in European Gaza, why is it so important? It was the only place where you had neurosurgery, cardiac care and cancer treatment to a certain level. The only positive point I want to raise actually when it comes to hospitals is Shifa, where also which resumes a little bit more amidst the destruction, a referral function. They have a 50-bed emergency ward. They see over 500 patients per day, but they start functioning again as a referral. Al-Ahli, which was non-functional, as you know, starts to become partly or minimal functional as well. So that is on the hospital. The last 2 points I want to raise is the mental health toll of the conflict in Gaza. I think it's incomprehensible. And I think it will last a lifetime for many. And Gazans, they have suffered unspeakable conditions over 19 months, displaced over and over, lost loved ones over and over. Human beings, you know, we are not built for endless fear, and even the strongest break under the weight of this constant trauma and uncertainty. And a body stuck in the fight or flight forget what safety flees, and the mind's always on the edge, slowly wears down. We always talk about Gazans, how resilient they are, health workers, how resilient they are. But you know, waking up every day without adequate food, healthcare, shelter, etc. So again, yeah, people can be resilient, and they are resilient, but no one should have to do and to be this resilient, this brave, just to stay alive. So WHO, we reiterate our call, first and foremost, for a ceasefire, an unconditional release of hostages, and let the UN and partners do their work. There was a plan and it delivered. There is a plan and it will deliver. Thank you.
Thank you very much, Rick. Thanks a lot for this update and this call. Sorry, before I give the floor to the journalists for questions, just let me remind you that yesterday, UN Women published new estimates that more than 28,000 women and girls have been killed in Gaza since the onset of hostilities in October 2023. The estimates mean that one woman and one girl on average are killed every hour in attacks by Israeli forces. Among those killed, thousands were mothers, leaving behind devastated children, families, and communities. These figures underscore the shattering human toll of the conflict and of lives and futures lost too soon. UN Women continues to work with women-led civil society organization in Gaza and joins the Secretary General in reiterating the call for an immediate ceasefire. The estimates with much more granularity are available on the website. If you have not received the press release, we can send it to you. So I'll now open the floor to questions. I've seen quite a few hands in the room, so I'll start with Agnès Pedero, AFP.
Yes, thank you. That's a question for Dr. Peppercorn, Mr. Seita, but also for Jens, I think for maybe a more global view. So Israel has announced that 5 trucks have entered Gaza, and I think 9 have been cleared. So the question now is who will be distributing this aid and how it will be distributed? And more generally, how do you feel? Do you feel that your calls of last weeks have been heard and understood by the Israeli authorities? Or on the contrary, do you feel that you are in a more complicated situation now with trucks? Yes, but only 5. Do you feel that you are like trapped? Thank you.
Okay, so I don't know, Jens is in the room, indeed. He will be coming to the podium, but maybe I can already give the floor to whoever wants to answer, or Louise.
Yeah, Rick, me, yeah.
Rick or Louise.
Okay. I'll try to lead. I'm sure Jens will come in as well. By the way, good morning, Jens. Good to see you. So, so first of all, I mean, and I think it's the win in the one UN, and I think I'm sure Jens will be a bit more specific. I think Tom Fletcher have been very clear on this as well. So I think, of course, the UN welcomes that some aid comes in, but we all have raised constantly it's a drop in the ocean, and absolutely insufficient. So that plan. And to deliver food and other items across Gaza is grossly inadequate to meet the immediate needs of over 2 million people. And I think for WHO, like other UN agencies, we echo this call for, stick to the global humanitarian principles of humanity, impartiality, independence, neutrality, to be upheld and respected for an unimpeded humanitarian access, and to be granted to provide aid based on people's needs, wherever they may be. And I want to reiterate again and again, there is a well-established and proven humanitarian coordination system led by the UN and its partners. Tom Fletcher has been very clear on that. That was working very well when there was a ceasefire and produced and delivered. It's already in place. It must be allowed to function and fully ensure that the aid is delivered in a principled, timely, and equitable manner. And just for health, for example, most of the WHO goods, 95%, they're in El Arish. Like there is 31 trucks waiting there, to the supplies. We also have trucks in the West Bank, and they're currently not allowed. So it's completely inadequate, drop in the ocean. Leave it there.
Absolutely. I see Louise has raised her hand, but I don't know, Jens, if you want to add something. I'll go to Louise. Louise, go ahead, please.
Just very quick to complement what has been said. It's very simple. Not enough. 5 trucks, nowhere near. Not enough. And the follow-up would be the evidence of the ceasefire. Look what the UN could do. We've done it. The ceasefire, the bombs stopped. The supplies went in. We reached every area of the Gaza Strip. We reached people who needed it most. We reached children. We reached the elderly. The supplies went everywhere. That's it. It's so simple. Not enough. Has to be more. Has to be sustained. Has to be now. And we've done it before. We're more than capable of this. Over.
Just to add to Louise that any functioning logistics system we welcome. But we had, as Rick mentioned, we have very good functioning system. Why we simply don't revive it? And then we also have lots of medicines and trucks in Arish and Amman. And unfortunately, some of them are expiring. That's becoming a main problem for us. And it's really sad to see that inside Gaza, there's a shortage of medicine. Outside Gaza, we have a medicine and it's expiring. That's really not acceptable. So we simply use the existing system, which used to function very well. Over.
Yes.
Yeah, thank you. Good morning, everyone. So yesterday there were 9 trucks that were cleared for entry. Out of those 9, 5 of them actually crossed into Gaza, if you like. For logistical reasons, 4 of them were not able to enter. As you know, the crossing has different stages, and there is a repacking, if you like, from one set of trucks to another set of trucks before it can move in. So it moves from different levels, if you like, of Israeli control. The last level where the 5 trucks entered are still under Israeli control, and we need permission to pick it up. That did not happen yesterday. However, this morning, we do have the permission to collect those 5 trucks. That is as much as I know right now. We do have the permission to collect those trucks, and we do have permission to collect more trucks that may enter today, and for as long as this, as we understand, temporary opening continues.
Thank you very much. And I think part of your question was also if we are still in contact with the Israeli authorities. The answer is yes, of course, continuously. You've got a lot of questions, and yes, but vas-y.
Yes. So no, the question was also who will distribute. I understand. So you have the authorization now to pick the trucks. I mean, and what is inside. So will it be UN, and if yes, which agencies will distribute then the food? And do you have already a plan of how you will do that? And yes, did the Israeli ask you for more security? I don't know. What can you tell us?
The 5 trucks that entered yesterday were 4 trucks administered by World Food Programme and 1 by UNICEF. They were allowed to carry nutrition products for children, supplements, and baby complementary food. This is what was allowed on the trucks when they were cleared as part of the 9. Okay, so 5 of those entered. Now the next step is to collect them, and then they will be distributed through the existing system, the one that has proven itself, as we have mentioned, all of us, many times. And the way it's distributed is the humanitarian way, based on need.
Luis, when you want to add something, just raise your hand up. Okay, so let's go to the next question. Emma Farge, Reuters.
Thanks, Jens. Sorry, just to clarify. So 5 got in, 4 stuck at the border, but you have permission to collect them. But the 5 that did get in haven't been distributed yet. Is that right?
The 5 were not picked up from the Gaza side last night. We do have now, and that is, if you like, a little new development, we do have the clearance today to pick them up and pick up other trucks that may enter that process whereby they kind of flow through the Kerem Shalom crossing.
Okay, and you said you had permission to collect more trucks today. So are you envisaging like a major scale up in the coming days? That's my question to you. And one for Rick, please. I'm just wondering, the discussions at the WHO on the emergency budget, we're looking at a reduced budget for the WHO for some of the emergency operations, like the important work you do in Gaza. Will your work going forward be ring-fenced, or will it also be scaled back? And can you react to a reduced emergency budget, how it will impact your work on the ground in places like Gaza? Thank you.
We have requested and received approval of more trucks to enter today. Many more than were approved yesterday. And we expect, of course, with that approval, many of them, hopefully all of them, to cross today to a point where they can be picked up and get further into the Gaza Strip for distribution.
Yeah, so 2 points. I think one is actually what Jens was referring to. So the few trucks which come in now, they will be distributed internally using the existing system, which has proven to us. So whether it is food, WFP, or UNICEF, Health, WHO, etc. The issue is hardly anything comes in. I mean, like, and that has been raised by all. On your question on the reduced budget, etc., on WHC, I mean, I think you should ask the DG or Mike Ryan. I think it's, but I think
in a
it's
few minutes.
But I can reflect a little bit of that, and of course we know that within WHO the crisis countries will be prioritized, and they have to be prioritized, whatever. So that is already will happen and should happen. Also, we and at WHO, I think we did relatively well in resource mobilization in the first 18 months, etc., from a variety of parties. We've had discussions also already with Alexandra, etc., the impact on the US cuts, even, which of course is also affecting us directly in OPT very seriously. Fortunately, we have a group of partners. Some partners are and member state donors, they're reaching out, and I want to stress we have delivered as WHO over the last 8, and partners recognize us and member states as well. So wherever we go, and we all hope, of course, we will go to a ceasefire, and then let's a peace process and early recovery and rehabilitation, etc. And then definitely health should be prioritized as well. Thanks.
Dr. Seta, you want to?
Just want to join your question that, yes, UNRWA is also extraordinary financial crisis. And then that we run the public like services like in say like 140 clinics, 700 schools in all the 5 fields of operations. And then we do not have sufficient fund to maintain this public like services fully in the second half of the year. Because of the political situation, financial situation, global situation, so that is extraordinarily difficult for us. Say we can't think of Gaza without UNRWA, which is the largest public primary healthcare operations. We can't think, say, West Bank without UNRWA, particularly in the northern part of the West Bank, that UNRWA is the largest primary healthcare providers together with the Minister of Health. And so really would like to highlight that the difficulties we are facing this in all the directions, and our Commissioner General is doing his best fundraising, but I can say that we are in extraordinary difficult situation. Yeah.
Absolutely, and we've discussed this already. Jamie Keaton, Associated Press.
Thank you, Alessandra. I have a few questions. Just to follow up quickly on Jens's latest comment, if you could specify, you said that you've gotten approvals for many more trucks to enter today. Can you be specific as to how many that is? Could you start with that? And then the other question about that is, how much have you noticed by past experience that when the number of trucks is lower, that it increases the risk of looting or diversion by desperate Gazans or by armed militant groups that may try? Because the fewer that you have, it seems to me, if you've got tens of thousands of Gazans who are desperate, there's going to be greater pressure on the fewer numbers of trucks. So the higher number, wouldn't that necessarily translate into less of a risk of diversion? As for both Louise and Dr. Peppercorn, you mentioned that there are negotiations, and Alessandra mentioned that there's talks with the Israelis. It seems to me that Israel, to a large extent, holds the cards here to a large piece. And so I really hope you can drill down on exactly what the United Nations is saying in these conversations, because the argument that Dr. Peppercorn made, which is that, let us do our jobs, doesn't seem to be carrying weight with the Israelis. Israelis are going back to the concerns about diversion and use by military groups. So what specifically are you saying to convince them that you doing your job means that it doesn't go into the hands of people that Israel doesn't want to see it going to? And just again for Louise, just very quickly, what is being done right there in those warehouses right now to get those supplies moving? Thank you.
Okay, let's start maybe with Jens. And yes, I mean, you're absolutely right. When you don't know when the next truck will come, you're probably desperate, and looting is a reality in that case. Jens.
Thank you, Jamie. On your first one, around 100. Past experience has very clearly showed that the less aid you get in and the less there is properly distributed in Gaza, the more desperation rises. And that has several effects, predictable effects. One is that the insufficient supplies are at greater risk of being looted. Why does that happen? Because it's being sold. It is being sold on what some people call a black market. I prefer a market of desperation. There's one way to remove this market of desperation overnight, in one go, and that is to open access for all this aid to come in to meet the needs of desperate people. And the market of desperation disappears, and there's no reason to loot the trucks. Okay? And these are commodities that I think I listed some of them last time, that are literally life-saving, have already been cleared by Israeli authorities. There's no dual use. What is there? There is baby milk, baby shoes, nutrition supplies for sheer survival. So if you allow this in, you will not have this market, there's no reason for looting, and the problem is solved. So back to what it is and why we are asking for all these, for this siege of Gaza to be lifted, that's why.
Absolutely. I don't know if Rick or Luis. Rick, you want to start, and I'll give the floor to Luis.
Okay. I think it's a difficult question, and actually, by the way, going back on looting, I remember that in February 24, we also had a whole series when aid was hardly coming in, and there was a huge food shortage, etc. So I was on a lot of those missions, and then you see this, of course, happening. If people think it's food, then they will jump on the truck, they try to slice it open, etc., etc. And things like that happen. So yeah, of course, there's a complete relationship. If you make sure that enough supplies get in, the looting and all the violence will quickly disappear. We saw that very much during the ceasefire, etc. But it was very well managed. There was hardly any incident. There was no incident actually on health products. In general, we are lucky. We announced that, so we actually we never see looting on that, and we announced that. Now on your other question, I think it's difficult. I think probably Jens and Ocha and also Tom Fletcher again have been very clear, actually answering that. If you looked at the ceasefire and the goods came in, 38% of the goods which came in were linked to the UN. Yeah, 38%. There's a whole monitoring system, including the 2720, etc., for that. And on the locked cluster, so WFP will very much do that on the food, and UNICEF on the wash, and we on the health. And let me then say something on health. Like the WHO essential medicines and medical supplies, they go directly to the WHO warehouses, two in Deir al-Balah and one in Gaza City, when allowed. I mean, like when we can move it. And from there, based on priorities and needs, we directly bring them to respective hospitals, etc., and health facilities for perusal. So this is how it works. And People know that. Israeli authorities know that as well. So let's make sure that we can continue implementing a system which has proven it delivered from the UN and partners, etc. And let's make sure that we can expand that system. Thanks.
Louise?
Thank you. Just to say, this isn't a new problem. This isn't a new siege. You know, the 11 weeks that we've had, that it's certainly been the longest time during this war that the aid and commercial supplies and any supplies haven't been permitted to enter the Gaza Strip. But I spent most of the last year in the Gaza Strip. I was there when the Rafah incursion started. At that time, when I arrived in Gaza in April, the border was open to Rafah. Once that border was closed, everything changed. Really, everything changed. So this is why we continue to call when you're asking what we're doing to get the aid around me into the Gaza Strip. This is part of what we've been saying for, you know, almost every day for the last 19 months. We need more access. Access is very critical to this. Seeing the operations in Rafah, seeing what we were and weren't able to get in at any time, and now not even having that crossing functioning, and continuously having to kind of reinvent how we're able to do logistics in the Gaza Strip. But most importantly, just to continue to reiterate that this isn't a new problem. The humanitarian response has been strangled since the very beginning of the war. There were weeks in the early days we weren't able to get any supplies in. Certainly the 11 weeks now have been absolutely devastating, but we rely very much on the international community and action there for any change. We need more crossings open. We need to get these supplies in. We need a lot. We need more access in terms of being able to reach people in the Gaza Strip. Over 70% of the Gaza Strip now is in displacement orders. It's very difficult for the United Nations to deliver aid when we are denied missions and we are denied access. So all of these things come together to get the aid supplies to the people who need them. And we need political cooperation for that to happen. Over.
Thank you very much. Yeah, you have a follow-up?
Quickly for Jens. Jens, you said that you've got the authorization to pick up today, collect. Any idea when that's going to happen? I mean, it is going to happen today, theoretically. Is that? I mean, are people on the move to pick those up now?
We will, of course, do everything in our power to get that aid in. I cannot say if people are on the move right now. It is a developing thing, and we have been, as you know, disappointed in the past. So when we can clearly confirm that there's been movements on anything, we will do so. But we want to be, you know, clear. We want to be, you know, solid.
Thank you very much. I'll go to the platform. John Zarocostas, The Lancet, and France 24.
Yes, good morning. Thank you for this briefing. I was wondering if, and it's addressed to both of you, the conflict in the OPT has been in the headlines, but I was looking at some figures from WHO, and I noticed your appeal for the health segment is only 6% funded out of nearly 600 million that you're asking for. If you could elaborate what's behind the lack of funding for this appeal on the health component. And secondly, if I could have some information on the supplies that you need urgently, and does that include medicines to treat people with problems of eyesight, and also medical equipment? Because I understand nearly 4,000 people are at risk of losing their eyesight at the moment in Gaza, on top of the 1,500 that have already lost their eyesight.
Thank you, John. I don't know if Dr. Setter or Rick want to start, and then I give you the floor. Or that you like?
Okay, so thanks, John. I think on the first part, And I see Margaret is there as well. So I think I didn't get so much what you meant with that segment and that, that specific segment, which was very underfunded. On the second part, let me say this. We constantly, and not WHO, we are leading the health cluster. So we do this with our partners, with all the health partners active. And from the start of this crisis, how we tried to prioritize straight away essential medicines and medical supplies was that we looked at the consumption of essential medicines and medical supplies from Gaza before this crisis, and then we tried to triangulate and and reprioritize because resources are always low, etc., and constantly assess. And this is how we plan as WHO, but also very much I want to say the partners, the cluster partners. There's many cluster partners. I mean, UNRWA is here with us, but there's many other cluster partners, etc., who play a key role on that. On the specific medical equipment, etc., that is, for example, we want to get in medical equipment, medical imaging equipment. There's only one CT scan working, and that's the one in Al-Ahli. It's insane. In the strip. That's the only one which is functional. Now we want to get in, and you can only do that when there is a chance for ceasefire and an early recovery, etc. We want to get in this medical imaging equipment, and if you talk about CT scans or MRIs, but also simple X-rays, mobile X-rays, etc., including some of the equipment you were talking about. Yes, it's definitely on our agenda. I also want to allude to that even before this crisis, it was very difficult to get this equipment into Gaza. The so-called dual use discussions constantly on that, etc. I remember the WHO, that me and my team, we struggled for 2 years to get 8 mobile X-rays in, and we had 2.5 years, etc. Like any referral hospitals have maybe 15 mobile X-rays, which you just get to the bed, etc. So that is insane. So even if we get to that phase, that needs to change. It's all on our list, it's all on the priority, etc. But we constantly have to reprioritize based on the top needs and what we are allowed to get in. Over to you.
Dr. Seita?
Yep. Thank you. As you know, we provide primary health care, and we do many things to prevent the eyesight loss, like treatment of diabetes, which is the main cause of the eyesight loss, and the vitamin A, as well as the nutrition. We do everything we can do, but we do not have enough medicines, we do not have equipment. But once somebody has serious effect, like we have no time to do that eye hand screening for the diabetes ones, because we do not have equipment. And so that yes, it is very unfortunate that many people cannot lose their eyesight, but this is the entirety of entirety of the loss of the medical services in Gaza, and then that results in the eyesight. So it is eyesight loss is very important, serious, but it's one of many problems which is very important. Says preventable, avoidable, and curable if the medical situation is better. Yep.
Absolutely. Margaret, can you shed light on the issue of the budget or the funds?
So, John, would you mind repeating? I was in the middle of something.
Oh, okay. I think it's about okay, John, maybe
just repeat the question if you could.
Yes. Good morning, Margaret. It's concerning the 4 billion appeal. The health segment was, I think, $596 million. And looking at some of WHO data, only 6% had been funded as of, I think, 6th or 7th of May, which is a very small amount given that the crisis is in the headlines every day. And I'm wondering what's behind the lack of funding by donors.
And so this is the appeal for Gaza itself?
It's for all the OPT.
The Humanitarian appeal.
Okay. So I don't have information specifically on that, but I will check to see if we've got any detail and you may find that there may well be more since. So I'll double check that for you.
Yeah. Thank you, Margaret.
Maybe I just can add one thing specifically for OPT in Gaza. And I think we've raised this in former press conferences very clearly, did well. relatively well resource mobilization first 18 months, etc. I think it's not just only affecting WHO currently, the whole of the UN. We see this as well. It's not just US. I think a lot of other partners, they are holding their cards against the chest. I mean, like they're very much with us and they're very impressed what we delivered, etc. Some reach out, so it's not all doom and gloom. Some reach out to us specifically in OPG, and they will continue, but much more is needed. And where I'm really concerned about, I mean, if we talk about, we're the biggest supplier of essential medicine and medical supplies in Gaza. So we will, if it would open up, we can continue that for another 3, 4, 5 months. We will still have, funds to do that. After that, I mean, like if that dries up, we are in massive problems, and the health system is on the brink of collapse, as we constantly say, but it's still partly too minimal functional. That is because of this kind of support. So it's absolutely essential that we focus, and that member states also focus their support on where it really matters, on the key priorities. Thanks.
Thank you very much. So I don't see other hands up for our colleagues, which is timely because in 5 minutes we have the French authorities, a French minister coming for the press conference. I just have 2 short announcements to make. You want to add something? No, it's okay. So just to remind you 2 things. First of all, that the Committee on the Rights of the Child is beginning this afternoon the report to review the report of Romania, which will be followed by Qatar and Brazil. And then I wanted to tell you that on Wednesday, 21st of May, at 10 a.m. New York time, so 4 o'clock here, the Secretary General of the United Nations, Antonio Guterres, will present together with Amina Mohammed, Deputy Secretary General, and Oscar Fernandez Taranco, will present the 2025 report of the chair of the UN Sustainable Development Group. And that will be done, of course, in New York. This report shows that the revitalized resident coordinator system delivers efficiency to improve lives. It will be, of course, in New York in person, but you can follow it on UN Web TV. And this is what I had in terms of announcements. I'm looking at Tariq, or I don't know if Margaret has an answer, to confirm the Dr. Tedros press conference. I don't know if you can say anything.
I think I can. I was certainly advised by his team that he's going to be on his way in the next 30 minutes. So the idea is that the press conference with him about the pandemic accord and with quite a few other speakers who were involved with the pandemic accord, including Dr. Mike Ryan, Dr. Jawad, Precious Masoso, they're going to be on their way in the next 30 minutes. So I advise you just to stay here.
Yeah. Great. The advice is shared, and I would also remind you that the press conference of the French authority is starting now. As usual, it's a permanent missions press conference, so we cannot send it out hybridly, but then we will, as I said before, start the hybrid function again for Dr. Tedros' press conference. And I can see here on my screen that Fadela is sending out the announcement now with all the details. I saw your hands, Jamie.
Sorry, I just wanted to follow up with Jens. I'm noticing that Tom Fletcher has spoken to some outlets about the number of babies who could die over the next 48 hours if aid does not reach them in Gaza. Can you tell us more about that? Do you have any details as to where that information comes from, that figure, just what the source of that figure is?
For now, let me just say that we know for a fact that there are babies who are in urgent life-saving need of these supplements that needs to come in because their mothers are unable to feed them themselves. And if they do not get those, they will be in mortal danger. So that is as much as I can say right now. If we have more specifics, we'll come back to you on that.
Anybody else? I'm looking at the hands. No? Okay, so thank you very much. I would like to thank so much all the people, all the colleagues who have briefed us now. Louise in Amman, Rick and Dr. Seta here in person, and Jens and Margaret, of course. So thank you very much. Stay with us, and we will wait for the French minister to arrive. And I'll see you at the next briefing on Friday. Thank you very much. Bye.